thanks very much for agreeing to present at our virtual KSS AHSN collaborative. I remember seeing you talk at the BTS just when you'd taken on the National Clinical Director role there. How's it been?
So, Joe, great question. I always say that when I went for the interview, there wasn't a single question on once-in-a-century viral pandemics. So, a real baptism of fire, but really enjoyed it. And I think that it's been a very difficult time for everyone, but the major positive is the importance of respiratory teams has really been recognised centrally, and it's allowed us to focus on improving outcomes, not just with regards to coronavirus, but across the board for people with chronic respiratory conditions.
And what do you see as the main issues just at the moment for respiratory medicine?
So I think now is a difficult time for respiratory medicine because, let's be honest, we've all worked really hard through the first pandemic surge and people are tired. But right now I'm asking everyone to follow up COVID survivors, plan for any potential future surges, as well as standing back up everything else that we have to do to try and prevent winterbred pressures this winter. So we're asking an awful lot of our respiratory teams, but I know that they're more than capable of delivering on them.
And it's a few months yet till October. With a crystal ball, is there anything else you think you might be talking about when you address us then?
So I think when we get to October, some things will have changed. Clearly, we've had some positive drug studies which help us with coronavirus, and we'll be looking at implementing those new therapies. We've really changed at pace how we deliver care, with a lot more virtual care. And if you ask me with a crystal ball, what I might be talking about is a lot more remote monitoring. So NHSX is looking at the NHS at Home programme to allow people to have care closer to home. So I think that will be one of the fundamental changes that we'll see over the course of this year.
Great, well, we look forward to hearing you talk then. Thanks.